So I have the pleasure of introducing Kirsten Seckler, Stephen Massey, Amanta Mazumdar,
Got the hardest name for sure.
and Jake Gurock.
Well done.
As you see, you're in the correct place for Shattering Stigma. Any additional information, please click the app, and please join me in welcoming Kirsten, Amanta, Jake, and Stephen.
Thanks.
Hello, good afternoon. How's everyone doing this Sunday? Yeah? We're the first session. Come on, you got to give us a little bit more. All right. Thank you, Andrea. Thank you for volunteering. Thanks for being here. And I want to give a very big, heartfelt thank you to all of you for being in this room today, because this is a subject that nobody ever wants to talk about. Well, we do. And we're glad that you're here to talk to us about it. So, as we said, we're going to have a conversation. I'm Kirsten Seckler. I'm the Chief Marketing Communications Officer at Shatterproof. I could tell you all about Shatterproof myself, but instead I'm going to go to the videotape, and you can learn all about the organization, and then we're going to dive into our conversation today. So again, thank you for being here to talk today about substance use disorder in the workplace and how we can all be a great solution to help those who may be impacted by this medical condition. We have some sound.
America's opioid crisis shows no signs of abating.
Tonight, a grim statistic. One American is dying from a drug overdose every 5 minutes.
Where the opioid epidemic has now evolved into a fentanyl nightmare.
There are millions of these dangerous fake pills out there, and they are killing thousands of Americans.
We have a vision that our society will look this disease straight in the eye, prevent it and treat it with love and empathy, and with protocols based on science.
We are coming together to increase awareness and funding for the prevention, treatment, and recovery of this disease.
We are here for friends. We are here for family. We are here for community. And we are here to bring the disease of addiction out of the darkness and into the light.
We are Shatterproof!
Son Brian struggled with addiction for 8 years, and during that time he went to 8 different treatment programs.
Shatterproof is currently developing public databases in multiple states that, if successful, will allow the public to identify, evaluate, and compare substance use treatment programs.
I would like to extend my appreciation to President Bill Clinton, Chelsea Clinton, and their Health Matters initiative.
I'm very grateful to be here today at a critical time to talk about why we must tackle this issue and what Congress must do to tackle this issue.
We need to start treating people in this country, not jailing them. We need to give them the tools they need to recover, because every life is precious. Every life is an individual gift from God. And we have to stop judging and start giving them the tools they need to get better.
I don't think about this issue as a public official or as a healthcare guy. I think about it as a father. I've talked to people who've been in the middle of this, and they're among the grittiest and gutsiest people I've ever met. And they deserve our respect and our love and our support.
Let's create that world that Brian didn't see. Let's create that world for the next young man that comes along, the next young woman that comes along, the next family. Let's drag addiction out of the shadows and into our hearts. I can't imagine a more perfect expression of humanity. Thank you.
So, that's just a little bit about Shatterproof, which is the organization that's brought this great group together today to talk about substance use disorder, which is probably arguably the biggest, largest public health crisis we are dealing with in this country. It started for centuries, we've been dealing with this, decades, but the pandemic really took it to a new level. And we have seen substance use disorder, whether it's alcohol or drugs, grow tremendously year over year for the last 3 to 5 years. And if you think it's not impacting your workplace, we are here to tell you it may be. Just a few bits of information. Number one, substance use disorder is a treatable medical condition. We do a survey with Shatterproof it's called the Shatterproof Addiction Stigma Index. And what we've learned is that 75% of the country doesn't understand that substance use disorder is a disease. Over 50% of the country believes it's a moral failing. And it's impacting almost 1 in 3 people, whether it's themselves or a loved one. So nearly 49 million people right now, as we speak, are living with substance use disorder, and that's ages 12 and older. It's the leading preventable cause of death in the United States. And even though the numbers have gone down slightly from 112,000 to 107,000, we're seeing 107,000 people die every year from an overdose. That's 11 people an hour. I always think, my God, if that were dolphins, this country would be up in arms. But it's not. It's people. It's our loved ones. And in addition to that, and that's drug overdoses, alcohol is killing people at 140,000 a year. So you add all those numbers up and we're losing about 22 people an hour. We're losing the equivalent of an airplane crash, a 747, every single day of the year. And I know I sound grim, but it's just, I want to put in perspective the amount of people who are impacted by this, because we're not talking about it. And therefore, people living in shame, they're living with judgment, they're living in fear, and they're not getting the treatment that they need. In fact, only 1 in 10 people are getting the treatment that they need. So we're here today with an incredible panel of people to talk about how do we start to talk about this in the workplace in a way that breaks down the stigma, that makes it okay for people to say, hey, we're struggling with something in our household, and we need your help here in the workplace. Because when we're spending 8 to 10 hours a day working someplace, we want to know that that's a community that cares, especially if you have this at home or you yourself are struggling. This is also a disease that knows no boundaries. It's really important to understand that the SAMHSA estimates that about 70% of the workforce may be struggling with substance use disorder. I think the latest number we heard was 161 million people are in the workforce across the country, so 70% are impacted. Just a couple other things to note. There are 50 million lost work hours, or 500 million lost work hours a year, and about 740 billion in total costs nationally each year. That's in productivity, that's in job loss, that's in those lost work hours. So we're economically really hitting the bottom line at our companies as well. And so I don't want to bring all this grim, information to you without saying that there is hope. And we're here today to talk to you about that and have a conversation about the hope that's available, the tools, the resources, the guide, and we want to hear from you. We don't want this to just be us having a conversation. We want this to be us having a conversation. We want you to use the microphone if you have questions or you want to voice a concern, because we also want to hear from people, what are you hearing? What are you struggling with? What do you want to learn so that we can make our tools and resources even better for all of you. So, I think that's my slide. Sorry, just keep things going. So as I said, I have a great panel here today who joined me. I'm going to let each of them introduce themselves and how they've been working in this space. So I'll pass it to you.
Wonderful. Well, thank you so much, Kirsten. It's wonderful to be here. This is my first time at SHRM, so I'm really excited to join all of you for this week. My name is Massey. I'm the co-founder of the Health Action Alliance. Some of you might be familiar with us. We're a network of about 17,000 HR and benefits leaders across the country, representing more than 10,000 employers. And they're champions, committed to improving health and well-being in the workplace and in the communities where they operate. And I'll say this is an issue that is so important to the companies in our network. One of the things that we're hearing, of course, is that substance use and overdose, the crisis is really taking a staggering toll on our economy, but it is taking a staggering toll on individual lives and individual workplaces around the country. And more we're hearing from HR leaders in our network that say that they're seeing SUDs or substance use disorders show up in their workplaces in ways that even just a few years ago was unthinkable. In fact, 1 in 11 full-time workers in this country has a substance use disorder right now. And most of us know someone who has a substance use disorder, or we may be in recovery. And I suspect that's what you're seeing in your workplaces. Kirsten, you mentioned the COVID pandemic, and just to kind of dig a little deeper on that, COVID created a space where feelings of isolation and loneliness really were increased, and those can be triggers for people with substance use disorders. And frankly, with so many of us working at home, it was just easier to access alcohol and both legal and illicit drugs. And so across our network, we're beginning to see employers really ask tough questions about how can they support workers who are either themselves in recovery or may need access to treatment services. It's important to note that on average, employees with substance use disorders miss an average of 5 weeks of work per year. So there's clearly a link between this issue and absenteeism and presenteeism in your workforce. We also know that drugs and alcohol use can increase workplace injuries and even lead to accidents on the job. In fact, half of all US employers now say that impairment on the job has increased their compensation costs. And so workers with SUDs are also more likely to leave their jobs, and employers pay an estimated $1,500 more in healthcare claims for employees with untreated substance use disorders. So employers see the magnitude of the problem, and they begin to understand the threat to their workforce, but very few are taking steps to take action, because there's still a lot of misunderstanding and stigma and uncertainty associated with this disease. In fact, in a recent survey of HR leaders in our own network, just 1 in 3 employers offers access to substance use and recovery programs, and just 1 in 5 have policies to promote or support workers who are already in recovery. Which is why we are so pleased to partner with Shatterproof and the National Council on Mental Wellbeing and the Ad Council and others to bring this issue firmly into workplaces and to support employers with free tools and resources. When you walked in, you should have received a postcard that has an that has a QR code, looks like this, has a QR code to a Recovery Ready Workplace Guide, which offers practical tools and tips to help you get started. It was informed by the incredible team at Shatterproof, and it's a great way for you to assess steps in your own workplace and begin the Recovery Ready journey. So I think I'll pause there. Thank you, Kirsten, for the invitation to be here, and pass back to you.
All right, great. Well, thank you. Amanta, please tell us all about you, who you are, and why don't you just tell us a little bit about what's been happening and the work that you're doing at Hilton?
Yeah, absolutely. And thank you, Kirsten, for inviting all of us to the panel here today. And thank you all for attending. So I represent the employer angle here. So I am the Vice President of Total Rewards at Hilton. I think everyone hopefully is familiar with Hilton. Maybe you're staying at one of our hotels during your time. There you go. I got guys. I love that. So we'll chat later. But we recognized that there was a need in this area just about a year and a half ago, and we partnered with Shatterproof just over a year ago, and we felt that this is an area that we wanted to invest and do more. So we really focused our efforts around reducing stigma on this topic and then making education available to our team members. So that Shatterproof has been great partners for us, and I'm happy to talk about the efforts that we've had and the reactions that we've gotten from our team members. But just this is such an important topic, and on a personal note, I'm a Chicago, I lived in Chicago for a long time, and the joke in Chicago was that you live through the winters to get to the summers, and today's a beautiful summer day in Chicago, and the fact that all of you are indoors, inside, chose to be at this event is so heartening to me. I wasn't sure how many people were going to show up, but this is really an issue that there's no winners or losers. Like, we all have to work together as employers, as public-private partnership to solve this issue, because there are people in your midst that I guarantee you are suffering with this. And maybe you know about some of them, maybe you don't know about some of them. But when we introduced our resources and put a spotlight on it, we had people, again, people that you would not maybe expect or know about, that came forward saying, thank you for putting a recognition on this topic. So it'll take all of us to make a difference. I just want to say I'm so proud that you all are here and thankful that you're all here.
Yeah, and I'm Jake Gurock. I'm a principal at Cerity Partners. We manage about $100 billion of wealth, but more importantly, I'm a person in long-term recovery. So, thank you. I've got a little over 9 years of sobriety, and I brought my sobriety calculator out, and that's 3,388 continuous days of sobriety, which I'm very grateful for.
Yeah.
Also, I'm a part of the Financial Planning Association, and SHRM blows it out of the water. This is like Disneyland. I mean, we have to step up our game. Very active in a 12-step fellowship, and I'm also an ambassador for Shatterproof, which I think is really leading the charge on this deal and is on the firing lines. I think looking at substance use disorder, I think the first thing is that we've come a long way. 4 generations ago, what they did to folks like me in solving addiction was to use shock therapy. I mean, if you went to the hospital a couple of times, they would hand you a bottle of liquor and then electrocute you. And that was the best that they could come up with to solve this problem. And if you showed up to the hospital more than 2 or 3 times, they'd commit you to an asylum. That was our best solution, was that in order to prevent people from drinking, we would lock them in a room for the rest of their lives. So I think we've come a long way from 4 generations to today. And I think it's generally understood, that it's a disease and not a moral failing. But just hearing those statistics, I mean, still 50% of folks think that this is a moral failing. So I just wanted to walk through what a day in the life of an alcoholic looks like and kind of describe the disease of addiction. I think where it starts is this feeling of restlessness, irritableness, discontentment, fear like none other, loneliness like none other. I was a prey to misery, prey to depression. That was way before I ever took a drink. Then I start drinking, and alcohol solved that problem for me. It was a solution towards that malady. And over time, I go from this malady to this mental obsession that somehow, some way, I'm going to beat the game. Somehow, some way, I'm going to control and enjoy my drinking. I work in finance, and that's a very big drinking culture. And I see colleagues of mine leave their drinks half full, which is shocking to me as an alcoholic. I would never leave a drink half full. But I was thinking to myself, that was my obsession, was that I would get to that level of drunk that solved the problem in me, and then not go overboard. But the problem is as an alcoholic, I take the first drink and a phenomenon of craving develops. I call it the physical allergy, which is really just an abnormal reaction to something. If I get stung by a bee, I'm not allergic to bees. I take the stinger out, it's uncomfortable for 30 minutes, but someone who's allergic to bees, their throat closes, they go to the hospital. And in the same way, an alcoholic has a bodily response that is different than moderate drinkers and hard drinkers. Moderate drinker can take it or leave it. A hard drinker oftentimes looks like an alcoholic. They may be able to drink the same amount, but given sufficient reason to quit, they get a DUI. They end up in the hospital. Their spouse is about to leave them. They're able to take the drink or leave it alone. The alcoholic is given plenty of sufficient reasons and finds that they can't stop drinking. So physical allergy, I go on a spree, I experience some consequences, and I've experienced quite a few. And then I emerge remorseful because I am sorry. It's not what I intended when I took the first drink. What I intended was to control and enjoy my drinking. And I make this firm resolution that I am not going to do what I just did again. And that last year of my addiction, I'm telling you, every morning I made that firm resolution. I could have passed a lie detector test. I mean, I meant it. But I end up back in the malady, restless, irritable, discontent, and at some point I just got to breathe. So I think generally we understand it as a disease, but there's still stigma attached to it. I think one of the things that Gary Mendel, CEO of Shatterproof, highlights so eloquently is that when we have a child who has cancer, the community rallies behind them. There's fundraisers that are thrown. We raise money for them. But when a child has addiction, we often implicitly and explicitly shun them. And the parents are often too embarrassed to even reach out for help because they blame themselves for a disease that affects 1 out of every 10 people in this country. So I think that we have a long way to go. I think that there are folks in recovery who are ashamed to admit that they need help. And I think the workplace is really going to be a place where we can offer a lot of help for folks. It's no secret that most of your life you are going to work. And I think we've done a good job in our legal system with drug courts. I think police officers have a decent understanding of addiction, but the workplace, we have a long way to go there. I'll pause there.
Thank you. Thank you all for sharing so much. So, Amanta.
Yeah.
Let's just talk a little bit about Hilton and what's just the path you took. What happened, or what was said, or what made you realize as a company is we've got to start to focus on this, and kind of what are the steps that you've been doing, and what are the fundamentals that you've been doing as a company, just as we think about from all the HR professionals, like what should they be thinking about?
Yeah, so we've been on a journey in terms of overarching supporting the well-being of our employees for many, many years. So we started a lot of our well-being efforts going back as far as 2017, and we launched an effort which we call Thrive at Hilton, and the overall philosophy is that in order to be well, it's not just your physical health, it's all aspects of your well-being. So we organize all of our efforts around body, we call it body, mind, and spirit. You might have similar frameworks in your companies, but all of the various programs that we have fall within those 3 pillars of Thrive at Hilton. And that doesn't include just our kind of health programs and our well-being programs, but we view it as even our learning programs, our growth, our development programs, those all contribute to your well-being and growth overall. So we started that in 2017 with various different programs, and we fully intended that that was going to be a framework and that was going to grow over time as we learned more about the needs of our population and got feedback. And like many of you as employers, there's things that you do centrally and then you learn from the field. We have 460,000 employees throughout the world, mostly decentralized. The vast majority work at our hotels. So we say stuff at corporate, but we also learn from our employees on the front lines. And with our population, with 460,000 employees, it's a very diverse workforce. And I don't just mean that in the traditional definition of diversity, but I mean that we have people working across 122 different countries. So language is spoken, cultural norms, jobs that we do, our largest job function is housekeeping, so large housekeeping population that we have. And so what we needed to do is we needed to put into place programs that met the diverse needs of our population, so specific programs. So long-winded to kind of start to the question of then how did we come around to substance use and addiction? And we tried to use the data to inform our approach, but we knew, and this is I think some research that Shatterproof had provided us, that in our industry, in hospitality and retail, the incidence rates of substance use and addiction anywhere between 1.5 to 2 times the national average. So we had a general sense that there was a good probability, there's a good chance that our team members were suffering from this more than the general population, and we wanted to do something about it. So that was a little bit of the why. Then the question is how, and what do we want to do? And this is, I'm sure, something all of you as HR practitioners face is, we all have budgets, we all have different priorities. So what would be the most effective, and what can our role be as an employer? So we really focused on 2 things. One was around reducing stigma on this topic, and second was increasing awareness and education on this topic. And the reason that we decided to focus on those 2 things is we wanted to say, okay, let's make some resources available both for team members who are suffering, but also for all their other colleagues who may not be suffering but are working with those team members. Let's make those education resources available to them. So that was why we wanted to do the education resources. But people only use resources if they feel comfortable using resources. Yeah. And so that's why we wanted to tackle the stigma problem as well, which I think is equally important as well. And so we did, and Kirsten and team were great partners. So Gary and our CEO, they did a company-wide conversation on this topic for 1 hour, where our CEO spoke quite eloquently with Gary. Gary shared his story around it, and this, I think, that's how we kicked off and started this effort. And I think what was beautiful about that approach is that it gave our team members an appreciation of, hey, the company cares about this. Our CEO just spent an hour talking about it on an all-hands call across the globe. And then we launched the resources. So the idea was, okay, let's give people cultural permission and then make the resources available. And then throughout the year, we continue to highlight it. We obviously participate in the walk that you talk about, and as a company, we do that. So that's been our approach. We track usage, we continue to do it, and we continue to think, how do we keep enhancing?
Great, thank you. So speaking of tools and resources, you shared a lot. You shared a lot of what is going on. So Stephen, tell us a little bit more about just some of the tactical things that are working for you, what you're seeing, what you're hearing from all of the thousands of companies that you work with on a regular basis.
Yeah, well, thank you, Kirsten. And before I do that, I just want to really applaud Amanta and his team at Hilton for being a real leader in this space. Really, the comprehensive program that you've launched at Hilton is best in class and something that is worth celebrating. And I'm so glad that you're able to be here and share that inspiring story with this group. When we think about how best to get started, it can certainly be overwhelming. And so we try to break it down into a couple simple steps. The first really is to start by examining the policies and practices inside of your workplace. And that really begins at the point of hire. The Americans with Disabilities Act protects people with SUDs at each day of employment. And in fact, some states like Illinois actually provide tax incentives to employers for hiring people who are in recovery. You could also go a step further by embracing what's called fair chance hiring, which is essentially a policy where you don't look at somebody's criminal history during the application process or before an offer has been made. Certainly, people with a criminal history who may have a substance use disorder, getting work, getting employment is so important to keep them in recovery. And so fair chance hiring is a way to create more space for people in recovery to find jobs. But it's more than just examining hiring policies. You need to also really understand the nature of your workforce. For example, does your workplace have safety hazards that could lead to injuries that would require pain medication? Do you have a stressful work environment where that can lead to mental health challenges, where drinking or drug use may be sought. And then finally, does the culture in your office encourage alcohol consumption during parties? Most of us celebrate during happy hours, and for folks who are either dealing with a substance use disorder or in recovery, that could be really challenging. So if you do have these types of structural issues in your workplace, consider how those issues could be leading to substance misuse. And we encourage you to talk to employees, to ask them how to improve your workplace to support workers in recovery, and it's a great way to understand how and where to lean in. A second step is to make sure that you can improve access to treatment services. This could include treatment and rehabilitation options specifically for your workers by improving access to comprehensive medical care and mental health care. There are a range of digital health solutions now available in this space, and pain management support could be really helpful for employees who may need pain medication. It also includes making sure that your employees who need treatment have access to paid time off or FMLA to seek their treatment, the treatment that they need. In fact, a third of Americans today struggling with substance use disorder don't think they can afford treatment or don't think they have the time off from work to be able to seek it. So a really important thing that you can do is to make sure that you provide coverage and make space for employees that need treatment for this medical condition to get it. And then finally, as Amanta said, the third step really is education. And what we know is that most Americans trust their employer. They trust their employer as a source of health information more than just about any other source, second only to physicians. And so it's really an incredible platform that you have to share public health information with your employees to fight stigma and break the silence. And I think hosting a town hall with your CEO is certainly an amazing way to create a space for open conversations. Training your managers to have those conversations in team meetings, identify signs of distress, and also use affirming science-backed language is also really important. And what we know is peer-to-peer support programs can be especially effective. There's a program at Salesforce actually called SoberForce. It's essentially an ERG for people in recovery. And it's a great safe space for people that may think that they have a problem. They can seek support from their peers, and for people who are in recovery to find the support that they need amongst their colleagues. Amazon has a similar program called Recovery at Amazon. So again, all of this may seem overwhelming, but the first step really is to publicly commit to creating a recovery-ready workplace. Doing so sets you on the path to get started. It sends a powerful signal to your employees and to your colleagues that you're there to support them and that you're willing to do what it takes to get them the care that they need. And as Kirsten said at the top of the presentation, there are lots of organizations, including I think all of us here at the front, that would be willing to help you as you embark on this journey.
Thank you. I also want to share, we were talking a lot about people who may be struggling or impacted and living with substance use disorder or people in recovery, but the fact of the matter is this is a growing issue, right? And we have so many parents in the workforce who have teens. I think about that number every day. I have a 13 and a 17-year-old, and when I hear that 49 million people are living with substance use disorder, and that's 12 years old and older, I gasp because I'm like, oh, that becomes reality as a parent, right? So I'm doing a lot to really think about prevention and how do I have these conversations. I also want to share that some of the tools that we offer at Shatterproof are around this. How do you have a conversation with your child around the dangers of fentanyl? This is a shape-shifting medical condition, and the threats are real. The painkillers, dope-sick narrative is actually about a decade old now. We're in a new narrative around fentanyl. And so I just share that, we're talking a lot about the people living with this or in recovery, but the fact of the matter is there are a lot of parents who are dealing with this as well as, how do I prevent this? And so when we look at the whole spectrum, and just wanted to make sure you're thinking about that as well when you're thinking about programs and education for your employees, because I'm sure if you're a mom like me, it's on my mind every time my kid leaves the house. But Jake, you are living proof that this is treatable. that recovery is possible. I love your story. I love that you're counting all of the hours, the days, I just think it's phenomenal. I think it is inspirational, but I also think it's a reality of what really can happen if somebody gets the right type of treatment, you have the right culture, you have the right environment that's supportive. Can you just tell, there's 22 million people who are in recovery, who are more Jakes out there. Tell us about what we can all be doing to create, more inclusive communities, more supportive communities. What makes that a great environment for someone who is living in recovery and, wants to feel like this is a great workplace that I can be in, or this is a great community that I can be a part of and I don't have to worry?
Sure. So I think probably the best place to start is just my own journey, which we have some visuals here. That top left-hand side, that's a shocking photo. That was the night before I went to treatment. And obviously, when you look at that photo, that's a 19-year-old kid who's very lost. But that's also a 19-year-old kid who grew up in an alcoholic home. My mom was an alcoholic. She's got 15 years of continuous sobriety today. And yes, very lost 19-year-old kid, but also a 19-year-old kid who had a 3.5 GPA in high school, who was offered a Division I college golf scholarship, who had a lot of things going for him, but was afflicted with the disease of alcoholism, the disease of substance use disorder. And I remember that night, I remember bits and pieces of that night. And I just remember being so terrified going to treatment. I knew that I had to. I had been getting into some trouble. I remember ending up at the police station again. And I was thinking about what I was going to say to my father so that he could pick me up from the station again. And I was thinking of a scheme over the phone. And I had a moment of clarity. I mean, something came over me, and I just said, Dad, I've got a problem, and if I don't solve it, I'm going to die soon. And he said, I'm on my way. And I ended up at a treatment facility in South Padre Island, Texas, of all places. If there's anyone from Texas, you know that South Padre Island is the spring break capital of Texas. And I was detoxing during spring break, which was even worse. But look at 60 days in recovery. I mean, those are two different human beings. And it's amazing what can happen when someone gets a second chance at life and has access to resources that supports recovery. I remember going there at 19 years old. I didn't know what sobriety looked like, but there were folks in there that put their arm around me and said that I actually didn't have to wait until I was 35 or 40 or 50 with a failed marriage and a job that I'd been fired from to go get some help. So that was 60 days, and I remember being in this treatment facility. Now, I'm from New Jersey, and I remember them telling me, for your aftercare plans, we want you to consider Lubbock, Texas. Does anyone know Lubbock, Texas? Guns up. I went to Texas Tech. And I remember telling the counselor there, the case manager, I said, well, can you show me a picture of Lubbock, Texas? And they showed me a picture, and I saw a tumbleweed. And I said, there is no chance I'm going to Lubbock, Texas. And eventually they convinced me to go, and it was the greatest decision I'd made in a long time. There was a very good collegiate recovery community there, where basically if you had a year of sobriety at Texas Tech University, they would help scholarship you into school. Now, at my first school, I had a 0.05 GPA, which I remember speaking with the president at Texas Tech about my journey. And he used to be a mathematics professor before he became the president, and he couldn't understand how it was mathematically possible to get a 0.05 GPA. And I told him, you really have to try. You really have to try to get that. And so I get connected with this collegiate recovery community. I went from a 0.05 GPA to a 3.95. I graduated at the top of my class, and I gave a speech at graduation. It's amazing what can happen to someone who's offered a second chance. I don't know what I would have done. Yeah, thank you. I remember pinching myself at graduation, giving a speech to other students. I used to be the kid that other parents would tell, you shouldn't hang out with Jake. He's not good for you, he's a tornado, and we're not going to let you hang out with him. And then all of a sudden, I was a student that people were looking up to. That's 3 years in recovery. I'd had an internship. This is an interesting story. At the time, when I was looking at internship opportunities, Texas Tech University, had the #1 ranked financial planning program in the country. And so a lot of firms would come out and recruit students. And at the time, when you looked up my name on Google, there was an article about me getting into some trouble. Now, ultimately, I wasn't even convicted on the things that that article was mentioning, but it was still written. And so in these 15-minute interviews, I had to address the worst night of my life. And out of the 12 interviews, mind you, I'm at the top of my class. I'm at the top of my class as a student. And out of the 12 interviews that I did, I only got 2 offers. And I was the best student there. The 2 folks who offered me a job knew recovery well. One was a man of faith, and he just believed in my story. And the other, his father passed away from alcoholism. The guy whose father passed away from alcoholism is now my boss. And he's in Reston, Virginia, and he offered me an internship. I drove 30 hours from Lubbock, Texas up to Reston, Virginia. And that's a picture of me at the firm that I currently work for today. But I just remember thinking, 3 years in, I'm missing out on all of these opportunities for something that was the worst night of my life that I've absolutely recovered from. At 3 years in, I was driving to the local treatment facility, carrying the message to other alcoholics, helping people get sober. I was actively involved in 12-step fellowship, recovery community. I mean, I was packing into the stream of life, not taking away from it like I was when I was using. 5 years in recovery. That's me and my mother. She's got 15 years of sobriety, and you can tell that we're both pretty happy there. 5 years was a big milestone for me. It's when it felt like I was going to do this for the rest of my life. I call these guys my recovery brothers. When you look at this group of people, in that photo there are 2 CEOs. There is someone who works at the U.S. Patent Office. There are 3 counselors and 3 business owners, a clergyman, someone who works at the church, and someone who's high up in Fairfax County government. So we come in all shapes and sizes, and I think what's so amazing about recovery is, and I think it's wonderful that we focus on diversity and inclusion, I think addiction recovery can be a catalyst for that. When you look at 12-step fellowships, we are people who would normally not mix well, but we share in this common bond of affliction and this common bond of a solution in recovery. And that's graduation. That's my mom, my dad. It was a very proud moment. And then today, you can see I've lost some hair along the way, but 9 years in, and I mean, if you would have told me 10 years ago that I'd help run a firm that manages $100 billion of wealth, I would have sent you to treatment. And I'll just share this one story. When we talk about recovery-ready workplaces, it should not be a shock to anyone when someone has addiction. It's going to be 1 in 10. So working in wealth management, wealthy families tend to struggle with addiction more so than others. And I remember having this one client, and her husband was very clearly an alcoholic. And I remember her asking, what am I supposed to do? Well, because I'm in recovery, I was able to connect her with someone to an Al-Anon meeting. She drove to this meeting. She had someone that she could speak with directly. And she's now part of that fellowship of recovery. Because this illness doesn't just affect the sufferer, it spreads to everyone. So how can we foster inclusion? I think it's already been mentioned, but I don't think every happy hour needs to be related to drinking. I think we can have fun without alcohol. One of my first years in my career, as part of our summer social, we went on a party boat. That wasn't very fun for me, I gotta tell you. I think no judgment zones. I think we should also be cautious about how we describe people in recovery or how we describe people in addiction. So often we use the term drug addict and it has such a negative connotation to it. I think we should use someone who struggles with this disease, who has substance use disorder. These are not bad people that need to get good. They are sick people that need to get well. Last thing I'll say here, I think what's helped for me is my employer has been so wonderful when it comes to recovery. I have adjusted my schedule. Every Monday I go to a 12-step fellowship, and every Tuesday morning I go to a Bible study at church. Those are two things that are very important to me, very important in my recovery, and they've adjusted my schedule for that. And I think no questions asked policy. If someone's coming up to you and saying, I've got a problem with this thing, we are not here to judge, we're here to support and offer solutions and resources.
Thank you.
Mm-hmm.
Wow. Your story's amazing. I want to make sure we have time before the session ends. If anybody has any questions, there's the microphone here. You're welcome to ask us any questions. I don't know if there's been any questions online. Oh, if you could just walk over to the microphone, that would be great.
Good afternoon, everybody. My name is Vanessa. I am from Colombia, but I live here in Chicago. A few years back, I had a very dear colleague who was an alcoholic. I remember a lot of us knew about it. I could smell it on him. We were in a very fast-paced consulting environment. We were doing M&A projects. There were a lot of deliveries. It was hard work. And I did my best to manage my friend. I kept the meetings to the mornings because I knew he didn't make a lot of sense by the end of the day. I protected him as much as I could because I loved him, and he was one of the most smart people I've ever met. But then he got really, really sick, ended up in the hospital. And I always wondered whether me protecting him and helping the best way that I knew how was me enabling him. What could have I done better had I known better? And I have no regrets because I treated him with as much love as I could. But if I had people like you and I would have asked the right people the right questions, what would you have told me then? Thank you.
Wow, thank you. Yeah. I think you raise a great point, right? Like how do we as individuals, how do we as community members support people? And I think you heard it in the video. We want to support people with love and empathy. The good news is there are tools and resources available on how to talk to a loved one. We have a Shatterproof Just 5 is a program that we offer. I'm happy to talk to anybody who's interested in it. That's what Hilton's using. But that has different lessons. How to talk to a loved one, how to talk to family member, others, how to spot an issue. These are the types of tools and resources that we have to offer. I think that you raise a really good topic, though, and what we're trying to also instill is making sure that HR departments are equipped for individuals to go to them for support without judgment, right? You know, that you don't want to get this person in trouble. You want to get them the help that they need. And that's the environment we're trying to create and with HR departments and companies because of the prevalence. So thank you for your empathy and your love for your friend. I think that's really important. But I think it's important that the systems be built there to support you, and that you know about them and you know that it's safe and okay to go and get the help for your friend and have the conversations with your friend within that workplace. Do you have any other things to offer?
Go ahead.
The one other thing I would say, right, like I first of all, kudos for the passion and the way that you tried to approach and help your colleague. I think we have to build HR teams that can support. It shouldn't be up to a specific manager to know what to do all the time. So I think, for example, in our case, we have a team member relations group that can help navigate these difficult situations. And then I would encourage, many EAPs have lines that actually managers can use for, especially if they go into medical type of issues. That's really, HR teams, it's not the easiest thing to navigate. So leverage the partners that you have, whether the resources like the ones that Kirsten is talking about, but other resources within your benefits ecosystem. I think those can be very helpful, and there's a lot of good content that's out there as well. Because otherwise it's too hard to have an individual manager know exactly what to do just on their own.
I would also just say quickly, I think it's really important when you have a coworker or a loved one to understand that you did not cause their addiction, nor can you cure it. And so I think it is reasonable to say, hey, I'm concerned about you, and then offer those resources. But I think you see this in every single family. The mother and father blame themselves for their child having addiction. They didn't cause it, but they also can't cure it.
Hi, I'm Isabel Wettergren. I'm a recovery-friendly workplace consultant, and I just love what you're doing. Jake, I applaud you for sharing your story of recovery, and I think that's one very powerful thing that we can do, is to amplify the voices of people in recovery. I look nothing like someone that lived under a bridge. I never missed a day of work. My children had sunscreen, healthy lunch boxes, but I dealt with alcohol and marijuana use disorder. So I think that one way to shatter the stigma also is to stop the stereotype of the person that lives under the bridge, and know that there's some of us in here that are struggling. There's some of us here that are celebrating their recovery. My question, I guess, is about peer support. What is the role of peer support? How do you create it? I'm a big fan of what they've done at Sober Force, and I'm just wondering, maybe you can take that question?
Yeah, well, it's such a great question. And first, I want to applaud you for your courage, and also the previous speaker or guest who came up and said you had so much vulnerability in what you shared. And I think every single one of us in this room feels very connected to what you just asked. So thank you for creating that experience for this audience. I think it's why it's so important that we talk about stigma. If alcohol and drug use wasn't such a highly stigmatized issue, there wouldn't be fear about having to go to the HR department or go to an expert to try to find support for that person. We don't treat this issue like a medical issue. We treat it like a personal failing. And if we started to treat this more like a medical condition, the way to support someone with a medical condition becomes a lot more clear and less charged. And so I think just having conversations and starting with stigma, that's why it's just so important. Peer-to-peer support programs certainly are really helpful. And you mentioned Sober Force. I mentioned also at Amazon, there's a growing ERG movement to support employees in recovery. And what we found, what they report, is that these employee resource and employee-led groups are a great first stop for employees that may be struggling, that they can reach out to this group and find a supportive group of colleagues who understand the journey that is required in that process of recovery. It's also a great support system for those who are already in recovery. And I think what's most important is that these ERGs can provide recommendations and advice to company leaders. And so I think a great organization, that HR department is engaging directly with ERGs to hear directly from employees about what things may need to change in a workplace. How can our policies or programs or workplace culture be strengthened? And so those ERG support groups can really become a great tool for that feedback.
Hi, my name is Sherry Gogler-Stewart. I'm the Director of Family and Spiritual Recovery at the Retreat in Wayzata, Minnesota. So I work in a setting that's helping people who struggle with this disease. My primary role is with the families. I oversee our family program. So I just wanted to touch on the prior question because I know that you guys have limited time. Tomorrow at 2 o'clock, I'm doing an entire session that's all about, let's talk about the families.
Oh, great.
Because the research shows that the number one thing that loved ones can do in this process is get support for themselves, and it always feels really counterintuitive. How do you even do that? So I have a lot of resources that I'll share around that. Just want to kind of, there's so few of us talking about this really important topic here, and so I'm so glad that you're here, and I just want to share that there's more conversation to come too. So thank you for what you're doing.
Thank you.
Hi, my name is Donna Bright, and I am a HR manager for an asphalt paving company. In our industry, unfortunately, there's a very high rate of suicide, substance abuse, all those things. One thing that I find is a lot of people are just uneducated. They're ashamed, they're embarrassed already, and just coming to you and talking to you about what you're able to help them with. So I found educating them that, hey, this is a disease just like if you had cancer, heart problems, whatever, so let's treat it like that, and what can I do to help you? And a lot of them, it's the fear of A, losing their job, B, not knowing how they're going to get a paycheck to support their family. So when I bring them in, the first thing I do is talk to them about benefits, short-term disability. A lot of people think they're not going to cover that, but they will.
Yeah.
So education, I think, is key. But my question, I guess, Jake, to you would be from a family aspect. And one of the things that we do is we bought a bolt-on EAP that really is more focused on the family. I find that I have employees who, they work together, fathers and sons, a lot of them, and they want to protect that child. How do we get that parent to help us get them the recovery they need and not, I don't want to use the word hinder the program, but you know, I've got a guy, well, he's going to lose everything if he doesn't get out of recovery or out of rehab. And the place will tell him he needs to stay. How do you convince that parent that it's better for them to stay that extra time?
Yeah, good question. It's always so tough because you're dealing with a parent who loves their child, and oftentimes that love turns into enabling, which does not help their child. So I think first things first is fostering the idea that the illness doesn't just affect the sufferer, it spreads to the entire family. And if you don't know if your child is alive or dead, that does something to you. That does something to your mind. That does something to your spirit, and you need recovery for that. I think it's on a case-by-case basis, but I think connecting them with a 12-step fellowship like Al-Anon, or connecting them with a group like Shatterproof is going to be very key. The success rate with parents listening to the advice is pretty low because they do love their child so much. But at least in my case, I've tried to be firm with parents that the job doesn't matter if we don't have a life. We need to have a sober life first, and then the job is next.
We're taking questions. I'm just going to put a couple things up on the screen because we are losing people. Shatterproof has a whole page, employee resources. Snap the QR code. I'll have my contact information. You can come up and talk to me afterwards as well. Here's also another QR code from HAA. I'll go back and forth.
Do you want to ask your question in the meantime?
And we'll take questions, but I just wanted to make sure I put that up there.
My name is Rosita Brockington, and I work for a municipality. One of our departments is governed by the Federal Transit Authority. And so even though marijuana has been taken off of the list because we have to go by the FTA, our employees that are considered safety sensitive still get in trouble for smoking marijuana or doing whatever it is that they do with marijuana. My question is there a push to calibrate the usage? Because I would like to believe that it's just in their system, not that they've used the day of. And so how can we get that movement going? Because it's creating a problem for companies or municipalities that have to deal with that.
I wish I had an answer on this, but I don't. Cannabis, marijuana is a very interesting topic right now. What we have been seeing is there was a lot of legalization, but now there is also a lot of studies showing that the use, especially before the age of 25, 26, is causing psychosis. There's a lot of really differing information out there on this. And we're actually at Shatterproof analyzing all of it right now. We like to say that the proof in Shatterproof is that everything we do is science-based. And so we're actually gathering all of the information we can, and we're looking at what the policy should be. So that's actually a priority for us, but we just don't have an answer right now.
Okay.
But stay in touch because we're working on it.
All right, thank you.
Yeah.
Good afternoon. My name is Cartier. I work for a nonprofit out of Metro Detroit. And my question is specifically, how do you get your CEO and your upper leaders involved? So I'm the HR director. And so when you said that you guys did that 1 hour CEO meeting, I think that's exactly what we need to do. We have town halls every other month. And one of my focus areas right now is on engagement and education. That's what I can push. We're a nonprofit, so we can't pay too much, but I know I can give you knowledge and information in your hands for you and your family. So how did you get your CEO involved in that?
Yeah, great question. We were lucky in the sense that our CEO and Gary have been colleagues and friends for a long time. So I think he fundamentally understood. He has seen Gary's struggle and the challenges that he's faced. So we had a bit of that personal connection that certainly was there. But I think beyond that, you just have to use the data, right? And I think that these guys have really great data that you can pull the stats, and when you pull it like 1 out of 3 or 1 out of 5 people, and you have how many team members or employees that you have, you could just extrapolate. That means there's this many people in your workforce that are struggling with this. And I think when you go with the data and you go with that, I think that for our leadership team, it was pretty eye-opening when they saw all of that. Yeah, stick with it. Even small steps are always moves forward, right? That's the one parting thing I would say is that just get started. And I think that if you start to do something, we've had people come to us and say, just thank you for recognizing it and doing it. And then you can always refine and build upon it and do more things.
There's also a calculator, National Safety Council website that Shatterproof built with the National Safety Council. It's a substance use calculator. If you put the number of employees you have into it, where you are, what it does is it aggregates a whole estimate of the economic impact that's taking on your specific business. So
it's a great tool.
Highly recommend using that because it'll wake you up to the millions of dollars lost, work time, productivity, job loss, all of the things that your CEO probably cares about. So there you go.
Yeah,
there's your numbers.
Yeah.
Hi, my name is Nirali Shah. I work for a nonprofit organization as a payroll manager, but we work in an HR team. So my question is coming up since the topic is going around about the addiction. So the addictions that they discuss about the adults, but our future generations, like the kids, who are more addicted with the video games. Like some kids, video games, YouTubers, like those reels, Instagram reels, that's affecting their mind. I have a 20 years old child who is in a college, and I have a 12 years old son. So I know how social media affects the kids when they're ready for the college. Sometimes, that's the age, I don't blame them, but that's their age that they want to listen more to their friends and social media, and parents struggle to make them understand. it's generations discussion, but do you have any brainstorming how we can protect or have that kids to make understand, like you should use your mind, like just think about it, like what is going to be beneficial for you. I just mentioned that to, I'm sorry, Sherry, that do you have anything in your mind, like since she works for the helping families, she said that there's a process, addiction, but then I think something that we should put like as in a workplace that helps parents to save their child who can come out from these addictions and be a better future generations from our nation.
Mm-hmm. Thank you. We focus at Shatterproof on substance use disorder, not on gambling or gaming or some of the other, addiction topics. However, I think there's got to be a movement around wellness for children in general, and I know that there's been a lot of studies recently around, how all this is, and I think you raised a really good topic that we should all be looking at and should look at for the future. So thank you.
Thank you.
Certainly as a parent, that's something that we talk a lot about with our peers, right? Because outside of the workplace, it's certainly a hot topic. And there's a lot of interesting research that's coming out on that. But certainly it is an issue, no doubt.
Yes. Yeah. Okay. Thank you.
Hi, my name is Jessica, and I'm an HR business partner. And as an HR business partner, I have several employees where I feel like I can see the signs. So I started off in nonprofit mental health, so I see some of the things. And then I also have family members that are extremely close to me that suffer with addiction. So a lot of times I can see the signs. You guys spoke about employees being out for like 5 weeks. So a lot of times it starts off as attendance issues, or it can be safety issues such as employees falling asleep on the job. And then you guys spoke about, like issues that may come up due to happy hours after work and things such as that. Unfortunately, what I realize is that when it gets to disciplinary action, a lot of times the employees themselves, they don't want to come in and seek the help because, like I said, I've dealt with things in the past in regards to like my family. I try to be very open with it. How do you recommend kind of encouraging and creating that psychological safety for our employees? A lot of times I do try to let them know, hey, I don't want to say, I think you have an addiction problem. But I can see the signs, whether or not it's signs that I see personally or whether or not it's signs that maybe coworkers or management might have seen. I'm trying to figure out that space to try to get them the help that they need without making them feel ashamed. We do have a lot of resources available to them, but it's just hard trying to get them to kind of understand that, hey, this is available to you, or some people, it's like, it's covered under FMLA. Short-term disability, like we have the benefits, but I can't force them to take it if that's not what they choose to do.
There's no easy answer, I think, to that. I mean, I really just think that the more you can encourage dialogue at a company level, I think that's the best thing you could do.
Yeah, I would agree. It's really just about creating space and having more open conversations. You're not going to be able to shift the culture overnight, and for someone who's struggling, it's going to take some time for them to build the kind of trust and confidence that, in fact, your workplace is a safe space to be able to share what they may be going through. But it's important to start and create that sense of openness inside the organization. And some of the strategies that we've talked about today, engaging leaders and others in the organization around this issue, could be really helpful.
I would also say frequency of check-ins. So if you have a culture of checking in continuously, maybe there's some dialogue of, hey, I know when we met 5 weeks ago, you said things were going okay. You mentioned things are not going so good right now. Let's walk through that. But I also just be mindful of this. What makes this disease so cunning, baffling, and powerful is that it speaks to you in your own words, and it's really easy to believe. I remember one of my very good friends, he was placed in a medically induced coma. And I remember holding his hand in the hospital, and he gets out of this coma, and we say, hey, buddy, we think you should go get some help. And he was on board. And it took us about 24 hours to schedule transportation. 24 hours later, we say, you ready to go? He said, I don't think I need to go. This is someone who just got out of a coma for alcohol-related issues. So I think being mindful of that. Part of the disease is shame. Part of the disease is it speaks to you in your own words, and it tells you that you actually don't have a problem, right? So I think frequency of check-ins is probably my best advice there. You're welcome.
Okay.
Can you wrap it up? Or?
Yeah. Thank you so
Thank you.
much. We appreciate you.